Hi everyone, I'm here to introduce my new action research topic. We'll be looking at trauma and its effects on chronic pain. So trauma is rapidly progressing as an invisible epidemic. With so many millions of people suffering from poverty, war-torn countries, domestic abuse, bullying, natural disaster, and violence, and so on, the number of counselors just can't keep up with the amount of help that people need in dealing with trauma and chronic pain. Not everyone can afford talk therapy. Not everyone has the time to drive and then sit through a talk therapy session every week or every other week. There has to be another way that we can help these people who suffer with chronic pain like this. In our world of athletic training, trying to grasp how trauma may affect our patient population is explained very well by Scott Musgrave, Ernie Quinliss, David Berceli, Robert Scare, Peter Levine, Douglas Bremer, and several other authors. In this brief introduction to my AR topic, I'm going to try to provide some insight to the human response to trauma and how we can assist our patients who suffer from chronic pain. So I will be your pilot and co-pilot for this wild ride, so buckle up and hang on.
So why can't I just get over it? Is a question a lot of people ask when they have issues with chronic pain. I decided to pursue this topic because in my clinical setting, I currently see a lot of patients who have issues with chronic pain. And a lot of times my hands are kind of tied because if there aren't any clinical findings that we can measure, there's really not a lot out there, I guess, available yet that we would use to treat these patients. I have had questions for a while about chronic trauma, maybe having an issue with chronic pain, so hopefully I can get some leeway with my new action research topic. First, we'll take a look at the brain and how it processes trauma. Traumatic experiences are processed differently than pleasant sensations. Trauma is intrusive and results in an overwhelming arousal of our system. So it kind of floods our system. So therefore, it's taken in as fragments rather than entire experiences where it becomes stored in sensory parts of the brain and becomes compartmentalized. The sensory parts of the brain are essentially the brainstem, the limbic system. The brainstem is one of the most primitive parts of the brain, so therefore it's there. Any type of traumatic event that happens even at birth or during birth is stored in that brainstem. So over time, the sensory parts become inundated with billions of bits of data that need to be associated with feelings, memories, and emotions, then sent to the Gnostic area to be told as a story, because that's how we operate as humans. We look at things as stories, as a chronological order of events. As long as these data are trapped, they remain chaotic and unhealed because they're kind of just floating around, not related to anything. So later on in life, when we are presented with cues that mimic the unprocessed stimuli from the trauma, it tends to trigger these unintegrated memories. This is called association. These memories are called flashbacks and nightmares. An association is anything like if you were trapped in an elevator and that was traumatic for you, like you're claustrophobic, then any type of elevator ride or anything that felt like an elevator ride you associate with that traumatic event of being trapped in the elevator. Or say you were attacked by someone. Like this happens a lot on like Law and Order Special Victims Unit. They always, the victims always say he wore distinctive cologne, or something they smelled, like they smelled the leather on his jacket or something like that. Every time they smell that cologne, they get that, they associate that with the attack. So animals are capable of this association as well. Pavlov's dogs, when they heard the bell, they would salivate. And my poor little parrot, Chai, doesn't like laundry baskets because of an unpleasant experience he had early on in life. But he's okay now. So here we have a picture of the limbic system. The limbic system controls most of the body's hormonal functions and is home to the hypothalamus and pituitary gland. These structures produce hormones in response to any type of physical or psychological stress and are directly connected to the adrenal glands. The limbic system is often referred to as the reptilian brain. A lot of times lately, it's popping up people having adrenal fatigue, and this can clearly be seen with people who are stuck in like the sympathetic response. And we'll see a little bit more how that happens in the upcoming slides. But I just want you to remember how the limbic system influences the adrenal glands.